Hi, my name is Carol Reitz-Barlow, and today I'm presenting on medication errors. This presentation fulfills the University of Mount Olive MSN Nursing 610 class. As an overview of the presentation, we are going to review Bandura's self-efficacy learning theory, medication errors, specifically a medication error, and preventable measures for medication errors. And as a side note, medication errors is covered in the RN to BSN Nursing 330 class, which is Law and Ethics for Healthcare Providers. The learning objectives for this presentation are: identify Bandura's self-efficacy learning theory, discuss a medication error, and identify 3 methods for prevention of medication errors. Bandura's learning theory is based on 2 foundations: self-efficacy and response outcome expectancy. Self-efficacy is based on a person's belief that he or she is capable of performing at a certain level. You take on a challenge and you learn from it. Typically, this is driven from an adverse situation. In the case of a medication error, the adverse situation could be an incident report, or worse, could be a bad patient outcome or a poor patient outcome. Response outcome is a person's behavior as a result of the situation. And in the case of a medication error, a nurse could perceive retribution from either leadership or from a board of nursing if they report an error. The outcome is dependent on the response. Let's talk about an example of a medication error in practice. This is actually happened in practice. There was a night shift nurse who had cared for 6 patients on a very busy medical floor. She had 2 of those patients with the same last name. One was a father and one was a son. And the father had requested something for a headache. The nurse pulled the medication from the automated medication dispensing machine. She took the medication to the bedside, scanned the patient, scanned the medication, and when she scanned the medication, she received an alert. The nurse bypassed the alert and gave the medication to the patient. She realized what she had done after she left the room. She had given the patient's son's medication to the father, so she gave the wrong medication to the patient. She did self-report, so that was a good thing. It's always best to self-report when you have a medication error. So let's talk about areas for improvement. The nurse should not have taken care of 2 patients with the same last name. That's also an educational opportunity for the charge nurse that assigned those patients to her. The nurse should verify patient identifiers prior to giving medications, and the nurse should follow 5 rights of medication administration. We can talk about the 5 rights of medication administration: the right patient, the right medication, the right dose, the right route, the right time, and that is what keeps everybody safe. The other thing that we need to talk about is barcode medication and bypassing the warning system that's in place for everybody's safety. The nurse should heed the barcode warnings that are applied when she scanned the medication. That concludes our presentation. Please take a moment to think about a medication error. You could evaluate, please evaluate this presentation and forward your evaluation tools to Dr. Robinson in the next 3 days. And I'll take questions if there's any questions at this point. Thank you.